పోస్ట్ పార్టమ్ డెలివరీ తర్వాత ఎట్లా ఉంటుంది వాళ్ళకి ఎమోషనల్గా అండ్ ఈవెన్ మామీ బ్లూస్ ఇవన్నీ ఉంటామంటే.
సో పోస్ట్ పార్టమ్ డిప్రెషన్ ఇస్ వెరీ కామన్ అండ్ వెరీ కామన్లీ
పీరియడ్స్ ఉన్నప్పుడు ప్రెగ్నెంట్ అవ్వరు అని అందరూ అనుకుంటూ ఉంటారు. సో ఇస్ ఇట్ అ మిత్ ఆర్ అ ఫ్యాక్ట్?
యూజువలీ పీరియడ్స్లో ఉన్నప్పుడు ప్రెగ్నెన్సీ అంటే ఫాలికల్ ఎగ్ రిలీజ్ అయ్యి
ఇన్ఫర్టిలిటీ అనుకున్నప్పుడు పీరియడ్స్ ఇర్రెగ్యులర్గా ఉంటాయి.
Irregular cycles indicate that the follicles are not growing and releasing on time, but doesn't mean follicles are
బ్రెస్ట్ ఫీడింగ్ అన్నప్పుడు కన్సీవ్ అవ్వడానికి కష్టం అని అంటుంటారు.
బ్రెస్ట్ ఫీడింగ్తో పాటు మనము ఉగ్గు అట్లాంటివి స్టార్ట్ చేసిన తర్వాత దెర్ ఇస్ నో.
ఫైబ్రాయిడ్స్ అన్నప్పుడు ఫైబ్రాయిడ్స్ విల్ కాజ్ ఇన్ఫర్టిలిటీ అంటుంటారు. ఎంతవరకు నిజం? వెల్కమ్. Let's keep health simple and real. Hi, I'm Dr. Sumina Reddy. Today we have Dr. Sumina Reddy, gynecologist, obstetrician, fertility expert and laparoscopic surgeon from Fertilica Hospitals. Let's welcome her. Thank you for joining us today with us, ma'am.
Yeah, thank you for inviting me.
Thank you. How are you?
I'm good. How are you?
I'm good, thank you. సో జనరల్గా ఉమెన్ ఒక్కసారి ప్రెగ్నెంట్ అన్నప్పటి నుంచి కొందరు ఫైన్, దే విల్ బీ ఫైన్, బట్ ఒక్కసారి ప్రెగ్నెన్సీ ఉన్న నాట్ ఎవ్రీబడి ఈజ్ ద సేమ్. అండ్ ఆఫ్టర్ ప్రెగ్నెన్సీ అందరికీ ఆల్మోస్ట్ సేమ్. ఇట్ డిపెండ్స్ ఆన్ ద ఎన్విరాన్మెంట్ హూ సపోర్టింగ్ యూ అండ్. సో పోస్ట్ పార్టమ్ డెలివరీ తర్వాత ఎట్లా ఉంటుంది వాళ్ళకి ఎమోషనల్గా అండ్ ఈవెన్ మామీ బ్లూస్ ఇవన్నీ ఉంటామంటే.
So I usually tell my patients, even through my personal experience also, most of the times pregnancy is the easy breezy part. What comes after pregnancy is the difficult thing, for which we are not prepared at all. Nobody talks about it. Nobody tells us about it. So yeah, it is important to create awareness and talk about the postpartum period also, because postpartum period you need a lot of help. A woman alone cannot cope up with everything. Manak antaru kada, it requires a whole village to raise a kid. So you need your spouse, what all family help you can have. If required, a nanny. Always seek out and take what all help you can take. And yeah, baby blues are minor hormonal changes because the body is going through lot of hormonal fluctuations, some amount of sadness and difficulty with to cope up with things. Also because in postpartum period, because you're breastfeeding or lactating, sleep complete ga avadu. Every 2 to 3 hours you're waking up. Some postpartum blues are common and you can change it with the help from the spouse or good lifestyle and family support. But when it is too severe, then it is called as postpartum depression. When you're feeling severely low, you're not interested in anything in life, you don't feel like taking care of your baby, that is called as postpartum depression. And it is important that if you see somebody is going through it, you should acknowledge it and respect them for that, instead of saying that she's just lazy, she's not bothered about things. That's not true. It is not that she's not interested, but she needs some help at that point. So postpartum depression is very common and very commonly underestimated also. So if you face such things, it is important that you come out to your doctor, speak about it. Is treatable. With simple medicines you can treat it, but you need to come out and ask for it.
Thank you for saying it.
Yes, that's true.
మెటర్నల్ మొర్టాలిటీ రేట్ గురించి ఇండియాలో చాలా ఎక్కువనే చూస్తున్నాము, బట్ నో వన్ టాక్స్ అబౌట్ ఇట్. సో వాట్స్ ద ట్రూత్?
So maternal mortality rate is one of the indicators of telling how the country's health system is doing. So if we look at our past history, like when we had our independence, maybe 75 years ago, maternal mortality rate was around 700 for 1 lakh deliveries.
Okay.
So 1 lakh deliveries ainappudu 700 women were dying per 1 lakh deliveries, which was very high, which indicated the kind of health services we had then. But after that, we have improved a lot in our health system. Presently, last whatever census were done, our maternal mortality stands at 88 per 1 lakh deliveries. So if we look at our own history, we have brought it down significantly. But even then, 88 is a big figure. These days, I don't think out of delivery any woman should die. But sometimes we need to understand that in a pregnancy or during a delivery, many things are unexpected. మనం ఎంత ప్రిపేర్డ్గా ఉన్నా కూడా sometimes obstetric emergencies can happen. So what is important is how well prepared you are and to recognize the women who are at high risk. So the doctor should be trained to recognize a simple case from a high risk case.
Okay.
Whenever there is a high risk case, there should be enough preparedness or shifted to a higher center where they can care for the lady. So once if you recognize a high risk case and take proper care, the mortality can be brought down to a lot of extent. But sometimes the difficult part is whenever it is unexpected. A simple lady also can land up with something like an amniotic fluid embolism, which is completely unexpected. Then it is really difficult. And the thing is, whenever a sick patient dies, it is understood. But whenever a pregnant lady dies, it is very difficult to explain, because the family is actually expecting 2 lives after that, mother and child. But now to explain that becomes difficult. But we need to understand that obstetric emergencies are a reality. We have brought down our maternal mortality rate to a lot of degree, but lot of work has to be done still.
ఓకే. పీరియడ్స్ ఉన్నప్పుడు ప్రెగ్నెంట్ అవ్వరు అని అందరూ అనుకుంటూ ఉంటారు. సో ఇస్ ఇట్ అ మిత్ ఆర్ అ ఫ్యాక్ట్?
It's partly myth, I would say, because human body is very unpredictable. Usually periods lo ఉన్నప్పుడు pregnancy ante follicle egg release అయ్యే chances are very less. But sometimes erratic ovulation can happen, especially when there are very short cycles. So most of the times periods lo ఉన్నప్పుడు intercourse వల్ల pregnancy రాదు, but sometimes surprises can crop up in life.
ఓకే.
Yeah. So it's always better to use a protection.
సో ఒక్కసారి ఇన్ఫర్టిలిటీ అనుకున్నప్పుడు పీరియడ్స్ ఇర్రెగ్యులర్గా ఉంటే ఇంకా మనిషి దే థింక్ దట్ షీ కెనాట్ కన్సీవ్ అని అనుకుంటా ఉంటారు.
That's the biggest myth.
ఓకే.
Yeah, irregular cycles indicate that the follicles are not growing and releasing on time, but doesn't mean follicles are not growing at all. Sometimes even women with very irregular cycles unexpectedly do conceive. So, but if you are looking for conception, you need to regularize the cycles. But if you want contraception, just because you have irregular cycles, I will not use contraception anukodamu tappu.
ఓకే.
So, even with irregular cycles also women can conceive.
ఓకే. అండ్ ఇంకొక మెత్ కూడా ఉంటుంది. జనరల్గా ఫస్ట్ బేబీ విత్ సి సెక్షన్ అయినప్పుడు తర్వాత అగైన్ దే కెన్ నాట్ హ్యావ్ వెజైనల్ బర్త్ అనుకుంటాం.
That's also a myth. So what is important is first time C-section అసలు ఎందుకు అయ్యింది? Is it a recurrent cause? అంటే సపోజ్ పెల్విస్ బాగాలేదు, వజైనల్ డెలివరీకి దారి బాగాలేదు అంటే మేబీ సెకండ్ టైం కూడా సి సెక్షన్ అవసరం పడచ్చు. బట్ ఇఫ్ ఇట్ వాస్ బికాస్ బేబీ పొజిషన్ సరిగ్గా లేదు, ఈసారి పొజిషన్ బాగుండొచ్చు. సో మోర్ దాన్ సి సెక్షన్ అయ్యిందా లేదా, ఇట్ ఈస్ కాల్డ్ వీబ్యాక్, వజైనల్ బర్త్ ఆఫ్టర్ సిజేరియన్. సో సిజేరియన్ తర్వాత కూడా వజైనల్ బర్త్ ఈజ్ పాసిబుల్, బట్ ఫర్ దాట్ ఆర్ యూ అ కరెక్ట్ క్యాండిడేట్ ఆర్ నాట్ అనేది ఆలోచించాలి.
ఓకే. బ్రెస్ట్ ఫీడింగ్ అన్నప్పుడు కన్సీవ్ అవ్వడానికి కష్టం అని అంటుంటారు, పెద్దల మాట ఇది. ఐ డోంట్ నో హౌ ట్రూ ఇట్ ఇస్.
So breastfeeding partially gives you protection, but there are specific conditions to it. That is, the baby should be exclusively breastfeeding. Ante breastfeeding to paatu manamu uggu atlantivi start chesin tarvata there is no protection.
Okay.
And usually the protection is better in first 4 to 6 months. And mother ki periods raakudadu. If all the conditions are there, then breastfeeding gives protection from pregnancy. But sometimes again we cannot expect, surprises do come up. Even within 2 months or 3 months of delivery also, even when they are breastfeeding, women do conceive and come down to us.
Okay. So again fibroids అన్నప్పుడు fibroids will cause infertility అంటుంటారు, ఎంతవరకు నిజం?
Not every fibroid causes infertility. Fibroids ఉన్న వాళ్ళు కూడా కన్సీవ్ అవుతూ ఉంటారు. What is important is the number of fibroids, size of fibroids and location of the fibroids. So fibroids uterus cavity lopala submucous position lo unte pregnancy becomes difficult. But if they are on the outer side of the uterus, subserosal ga unnappudu people can still conceive. So as I said, any fibroids unnai, if there are small fibroids that's fine, you can ignore it. If there are multiple large fibroids, again conception becomes difficult.
Okay.
So it depends on the number, size and location.
You need to rest from pregnancies అంటూ ఉంటారు. 2 pregnancies మధ్యలో 2 years గ్యాప్ ఉండాలి అంటూ ఉంటారు. సో ఇస్ ఇట్ అ myth or a fact?
Rather than myth or fact, it is possibly a good practice advice.
Okay.
That is, if I mean, back-to-back pregnancies, well, it takes a toll on the body of the woman. You need to give some rest for the body to cope up, again replenish with the calcium, vitamins, proteins, and everything. So taking a 2-year interval is good for mother, but nothing hard and fast. If you're at the, say, suppose late 30s or 40s, then there's no point waiting, no?
True.
First finish your family and then take the break.
Okay.
Yeah.
సో పపాయ తిన్నా, పైనాపిల్ తిన్నా, అండ్ సెసమి సీడ్స్ తిన్నా, ప్రెగ్నెంట్ ఉమెన్ తిన్నప్పుడు మిస్క్యారేజ్ అవుతుంది అని అంటుంటారు.
ఇట్స్ వన్ ఆఫ్ ద బిగ్గెస్ట్ మిత్. నార్మల్గా మనం తినే ఫుడ్ దేనివల్ల మిస్క్యారేజ్ అవ్వదు. ఇంకా ఆలోచిస్తే కొంతమంది అబార్షన్ కావాలని కూడా పపాయ తినొచ్చే వాళ్ళు ఉంటారు. సో నథింగ్ లైక్ దట్ రియలీ వర్క్స్. ఇఫ్ యూ వాంట్ ఎంటీపీ టు బి డన్, టర్మినేషన్ ఆఫ్ ప్రెగ్నెన్సీ, యూ నీడ్ టు కమ్ టు అ డాక్టర్, గుడ్ రిజిస్టర్డ్ డాక్టర్, అండ్ గెట్ ఇట్ డన్. జస్ట్ బికాస్ పపాయ తిన్నాం, పైనాపిల్ తిన్నామని అయితే మిస్క్యారేజెస్ అవ్వవు. సో ఇట్స్ అ బిగ్ మిత్.
ఓకే. సో పాలిసిస్టిక్ ఓవరీస్ అండ్ పీసీఓఎస్ రెండు ఒకటే అంటారా?
సో పాలిసిస్టిక్ ఓవరీస్ అపియరెన్స్ అనేది మనకు అల్ట్రాసౌండ్లో కనిపించే పిక్చర్. వెన్ ఎవర్ యూ సీ బిగ్ బల్కీ ఓవరీస్ విత్ లాట్ ఆఫ్ ఫాలికల్స్ ఆన్ అన్ అల్ట్రాసౌండ్ స్కాన్, దే ఆర్ కాల్డ్ పాలిసిస్టిక్ ఓవరీస్. Along with polycystic ovaries, when a lady has irregular cycles, weight gain, acne, unwanted hair, pigmentation, when all of these things are present, then it is the polycystic ovarian syndrome.
Okay.
So just picture scanning lo polycystic ovaries unnanta matrana doesn't mean anything. But if you are experiencing irregular cycles, weight gain, then that's not good. You need to seek out help at that point.
Okay. So woman biological clock stops at 40. Is it a myth or a fact again?
No, it doesn't stops abruptly at 40. Periods do continue, ovulation happens. Few women conceive also after 40. So it's a myth. It doesn't come to a halt just like that.
Okay.
But yeah, of course, the number of eggs and the quality of eggs definitely goes down after 40.
Actually, ఇది చాలా కామన్. అమ్మాయిలు కూడా చెప్పుకోరు. Vaginal discharge. Is it normal?
So some amount of vaginal discharge is normal. Like anywhere in our body, any cavity, like in the mouth, in the nose, in the eyes, everywhere there are secretions. So it is important to keep the mucosa moist. But when that discharge is associated with foul smell, odor, or itching, irritation, redness, then it means there is an infection on top of it.
And color change?
Yes, color change is abnormal. So curdy white discharge or yellowish discharge, that is not normal. But some amount of discharge, and also we can see cyclical changes like ovulation, mid-cycle time lo secretions koncham perugutayi.
Okay.
So that is normal. But whenever you see rash, itching, bad smell in the discharge, then it is infection. You need to seek out help at that point.
So vaginal discharge అన్నప్పుడు again I remember that breast cancers చాలా అవుతున్నాయి మీరు చూస్తూ ఉంటే. And it's not about above 40 అని కాదు, above 50 అని కాదు, even in young women. Screenings ఎంతవరకు ఇంపార్టెంట్ అంటారు?
Screenings are very important. Breast cancers are alarmingly increasing in our country. At one point, cervical cancer was the most important cancer, but now breast cancer has overtaken. Interestingly, I don't know whether it is good news or bad news. Definitely not good news. Hyderabad is the cancer capital of India, breast cancer capital. So a lot of women, young age, as young as 20s, early 20s also, getting diagnosed with breast cancer. So it is very important for us to educate women as to what is normal and what is not normal. So screening methods are very important. The simplest and the most important screening that you can do is breast examination, self breast examination. So every month of your period, after your periods are over, either when you are alone in your room or whenever you are taking bath, you need to palpate both your breasts and see ఏదన్నా మాస్ గ్రోత్ లాంటిది ఉందా, స్వెల్లింగ్ లాంటిది తగులుతోందా చేతికి, గడ్డ లాంటిది, ఏదైనా డిశ్చార్జ్ ఉందా, బ్రెస్ట్ సైజ్లో తేడా ఉందా, you need to observe it and make a note of it. If something like that is there, then next step is you go for a clinical breast examination. You go to a doctor and say, I noticed this, is it okay or not okay? Along with that, now I think every woman from the age of 35 should start getting screening methods. Screening method includes mammogram and an sonomammogram.
Okay.
Mammogram is through an X-ray kind of equipment, and sonomammogram is ultrasound. Both should be done together.
Okay.
And whenever there is a growth or lump detected, you need to do a biopsy from it and see if it is okay or not okay. Not every lump is cancer. Sometimes benign fibroadenomas kuda untai. But whatever it is, it shouldn't be ignored.
True.
And if you get a good mammogram done regularly, see, suppose చేతికి ఒక గడ్డ తగలాలి అంటే అది minimum 2 centimeters ఉండాలి. Whereas mammogram lo, if you get a regular mammogram, a small change as much as half centimeter also will get diagnosed. So you can diagnose it at an early stage. So whenever it is diagnosed at an early stage, the treatment is complete. Whereas at a later stage, the treatment is difficult, longer, involves multimodality, chemotherapy, radiation and all. So the screenings are very important for breast cancer.
సంథింగ్ ఐ హ్యావ్ టు టాక్ అబౌట్ పెయిన్ఫుల్ సెక్స్. చాలా వరకు ఎవరు ఓపెన్గా మాట్లాడరు అండ్ వచ్చి కలవరు కూడా యాజ్ అ గైనకాలజిస్ట్ అండ్ ఆల్. సో వాళ్ళకి ఏం చెప్పాలనుకుంటున్నారు?
No, some amount of difficulty in the beginning of your sexual journey is common. But later, after giving some time to each other, once you are spent sufficient amount of time, if it is still painful, then you need to seek out medical help. There can be multiple reasons on both sides, the female partner and the male partner.
Okay.
So something like a imperforate hymen or severe adenomyosis or endometriosis, and even as simple as pelvic infections also cause painful intercourse.
Okay.
Or menlo, if there is erectile dysfunction, such kind of things or infections also cause difficult intercourse. And one important thing is vaginismus. Vaginismus ante you must have definitely heard about it. Very difficult condition. People don't come out openly. Subconsciously, the woman is not able to allow a penetrative intercourse. There is there's nothing wrong physically. Everything is fine. But maybe because of some childhood bad experience or some myths about this or very strict upbringings sometimes cause vaginismus, where subconsciously she is not allowing a sexual intercourse.
Okay.
So again, that requires lot of patience, counseling sessions, desensitizations, and then gradually they will open up.
Okay.
But whenever there is difficulty, you need to seek help.
సో మెనోపాజ్ అండ్ లిబిడో చాలా తక్కువ మాట్లాడుతూ ఉంటారు దీని గురించి కూడా. మీరేం చెప్పాలనుకుంటున్నారు?
See, menopause is just one stage in life. ఒకప్పుడు లైఫ్ ఎక్స్పెక్టెన్సీ 60 ఉన్నప్పుడు 50 అంటే సరే ఇంకా లైఫ్ ఆల్మోస్ట్ అయిపోయింది అనుకుంటా. ఇప్పుడు లైఫ్ స్పాన్ ఆల్మోస్ట్ 80s వరకు చూస్తున్నాం ఈజీగా. సో 50 ఈజ్ అ మిడ్ లైఫ్. సో యూ హ్యావ్ గుడ్ 30 years of life even after that. So even when you are in your 40s start అవుతున్నప్పటి నుంచి you need to take care of your health. మెయింటైన్ లైక్ ఆస్టియోపోరోసిస్ అందరూ విని ఉంటారు. బోన్ మాస్ తగ్గిపోతుంది ఏజ్ పెరిగే కొద్దీ. సిమిలర్ టు దట్ దెర్ ఇస్ సంథింగ్ కాల్డ్ అస్ సార్కోపీనియా, అంటే మజిల్ మాస్ కూడా తగ్గుతూ ఉంటుంది unless and until you exercise every day. So from 40s it is very important that you exercise, take good diet, take care of your body, nutrition, mood and everything, so that your hormonal health is good, you are in good state. When you are in a good state, then libido also is good. And yeah, when you are coming to near 40s, late 40s and 50s, because menopause starts acting up, your hormones are also low. When hormones are low, vaginal dryness is a problem.
Okay.
But for that, again, you can use hormonal replacement or vaginal lubricants. So we need to create an atmosphere where the women can talk openly about such things. So menopause is a midlife, definitely not end of life. So there's a long life after that also. You need to take care of your health.
I guess slowly they are changing.
Yes, they are changing. And it is important that they should change.
Okay. Yeah. As a woman doctor, gynecologist, and okka supplement edana like every woman should take.
Yeah. So to pinpoint one supplement is difficult. But if I really have to pinpoint one supplement, maybe vitamin D. That is because these days sun exposure, బయటికి వెళ్ళడం చాలా తగ్గిపోయింది. Nevertheless, most of the Indians are deficient in vitamin D because our outdoor activities are very less, especially urban population.
True.
So vitamin D every woman needs to take. Apart from that, even calcium and iron also. Anemia is also common in our women.
Okay.
So vitamin D, then following that calcium and iron.
One final message women ki చెప్పాలంటే ఏం చెప్తారు?
So whatever we have spoken all through, women tend to put themselves at the last of the list. So they take care of everybody in the family, husband, kids, parents, and వాళ్ళ health గురించి ఆలోచించేసరికి they are running out of energy and patience. So probably if we want to say one thing, maybe learn to put yourself at the top of the
First,
list.
yeah.
If you take good care of yourself and your health is good, you will have enough patience to care for everybody
True,
else.
true.
So women should learn to put themselves in the top of the list.
Good, good. So thank you for your insights, ma'am. Thank you so much.
Oh, pleasure is mine, Mansa.
Thank you.
Yeah.